Reflexes and what they tell the doctor. How many times have you seen the following, whether on TV or in reality? The doctor briefly shines a flashlight in the patient's eyes or taps his knee with a hammer. But what exactly does the doctor intend with this? Quite simply, the doctor tests the presence of a certain reflex. A reflex in the medical sense is always the same involuntary reaction of the nervous system to a certain stimulus. The doctor knocks, e.g. the knee joint extends to a certain point on the bent knee. If the doctor shines a flashlight in the eye, the pupils should narrow due to the incidence of light. Reflexes are vital for humans and animals. They are automatic and stereotypical and enable us to react quickly to changes in our environment. Decreased, missing, or intensified reflexes allow conclusions to be drawn about various disorders or illnesses and thus help with diagnostics. One differentiates between so-called internal and external reflexes. Self-reflexes. Self-reflexes are reflexes in which the reflex response takes place in the same organ in which the stimulus was triggered. After the stimulus has been triggered, it is directed into the spinal cord via special nerve fibers and transferred to a so-called motor neuron via only one switching point, monosynaptic. Motor neurons control the skeletal muscles in the broadest sense. The various self-reflexes allow doctors to check the individual spinal nerves, and other neurological functions. Here are a few examples. 1. Achilles tendon reflex. The Achilles tendon connects the calf muscles to the heel. To test the Achilles tendon reflex, the patient lies e.g. on the stomach. The lower leg should protrude beyond the edge of the examination table, with the feet pointing down. The doctor presses the foot slightly in the direction of the shin and taps with a test hammer briefly on the Achilles tendon above the heel. In a healthy patient, the foot should stretch briefly like a ballerina. If there is no reaction, apart from damage to the Achilles tendon itself, a peripheral nerve injury, e.g. by a herniated disc in the upper sacrum, S1, the cause. Spinal cord injuries or neuropathy are further reasons for a reduced or missing Achilles tendon reflex. If the reflex is increased, this indicates like an increased patellar tendon reflex, a lesion of the pyramidal tract, brain damage. Other intrinsic reflexes on the upper extremities, such as the biceps tendon reflex, C5-C6, or the flexion of the fingers, C7-8, allow conclusions to be drawn about possible damage to the spinal nerves of the cervical spine. In a nutshell, the pyramid railway is a bundle of motor nerve fibers that runs from the brain to the spinal cord and coordinates our movements. Lesions in this area can include e.g. come from a stroke or various neurological diseases, such as multiple sclerosis or amyotrophic lateral sclerosis. If the pyramid tract is damaged, the so-called pyramid tract signs can be triggered, in which the muscle reflexes such as the patellar tendon reflex or the Achilles tendon reflex are increased. Pathological reflexes such as the Babinski sign can also occur. 2. Posterior tibial reflex. The posterior tibial reflex is an important diagnostic criterion for a herniated disc in the 5-lira area. The tibialis posterior muscle, the posterior tibia muscle, controls the elevation of the inner edge of the foot. To achieve such an elevation, the doctor strikes with the reflex hammer directly under the inner ankle. If the reflex is absent or reduced, this indicates a herniated disc in area 5-lira. However, the reflex should always be tested and compared on both feet, since it cannot always be triggered even in healthy people. External reflexes. In the case of a third-party reflex, the stimulus and organ of success are different. The reflex arc, i.e. the cascade triggered by the stimulus, runs over several synapses, polysynaptic. A distinction is made between physiological, healthy, and pathological, external reflexes, which can only be triggered in patients with certain diseases. The physiological external reflexes include, for example, 3. Pupil reflex. The pupil reflex protects our eyes from too much light. If light falls into our eyes, the iris of our eyes closes like an aperture, and the pupil becomes smaller. Doctors test the pupil reflex, e.g. accident victims who are at risk of brain injury or suspected stroke. With a small flashlight, the doctor shines in the patient's eye for a brief moment and checks whether this causes both pupils to narrow in both eyes at the same time, direct and indirect pupil reflex. If a pupil difference, anisochrony equals pupils of different widths, is noticeable during the pupil control, the doctors must assume that the brain is damaged, e.g. by increased brain pressure on one side. Damage to the optic nerves can also be the cause of a sluggish or missing light reaction. In addition, severely dilated pupils can indicate abuse of drugs, e.g. cocaine, and certain medications, amphetamines, or poisoning, e.g. from thorn apple, laburnum yew. Poisoning from muscarine, poison of certain fungi, or taking morphine, on the other hand, leads to a pupil narrowing. 4. Gag reflex, tracheal reflex. In healthy people, the so-called gag reflex occurs as soon as the doctor touches the back wall of the throat with a spatula. This reflex protects the airways from foreign bodies such as food or liquids. Furthermore, it will e.g. triggered when eating extremely bitter or bad-tasting food. The gag reflex is like the eyelid reflex, one of the protective reflexes. The gag reflex is more common in some people. This can sometimes have psychological causes. On the other hand, the reflex can be completely eliminated for people who suffer from an addiction to eating, bulimia. Other external reflexes are the abdominal skin reflex, the cremaster reflex in men, and the anal reflex. 5. Reflexes to determine brain death. Reflexes are also important criteria for determining brain death. In brain-dead patients, among other things, the pupil reflex, the gag reflex, the eyelid reflex, and the so-called oculocefal reflex are absent. In comatose or unconscious patients, the eyes make a slow countermovement through the oculocephalic reflex if the doctor quickly turns his head to one side. On the other hand, if the patient is brain dead, the eyes remain in their starting position. There are many other reflexes, such as self-reflexes and external reflexes. There are also early childhood and pathological reflexes. These say a lot about our health. In order not to blow up the video with information, we only use 2 examples for each, self-reflexes and external reflexes. Thanks for watching and help me to help other people, because together we are strong and can help people in need.